One and action.
Today I'm going to be talking to you about response interruption and redirection, or RIRD, along with stimulus matching to reduce repetitive speech in children with a diagnosis of autism. According to Murphy et al. In 2009, repetitive speech and other repetitive behaviors occurs in about 72% of individuals with a diagnosis of autism spectrum disorder. Engaging in repetitive speech can impede learning opportunities, be subject to stigma, therefore interfering with social interactions and social opportunities. It can interfere with functional communication and just be disruptive to others in the individual's immediate learning environment. Several studies conclude that RIRD is an effective intervention for the reduction of repetitive speech, including studies by Mulligan et al. In 2014 and Cologne et al. In 2012. Others, such as Dickman et al. In 2012, were unsuccessful with reducing repetitive speech. According to Love et al. In 2012, studies have shown that stimulus matching procedures are successful with reducing repetitive behaviors that are maintained by automatic positive reinforcement. According to Ahern et al. In 2007, research found that stimulus matching leads to a reduction in vocal stereotypy. The purpose of the current study is to combine RIRD procedures with stimulus matching procedures in order to reduce repetitive speech. The current study will be held in clinic, and data will be collected throughout 35 hours of direct therapy per week. You will be using a reversal research design consisting of 3 weeks of baseline, 3 weeks of intervention, 3 weeks of baseline, and another 3 weeks of intervention. The clinic setting will consist of a treatment room with 1 table, 3 chairs, and several toys and activities for the participants to engage with. The 3 participants for the study will include 2 5-year-old boys and 1 6-year-old girl, all with a diagnosis of autism spectrum disorder. All 3 participants currently engage in high rates of repetitive speech and mostly use assistive devices for communication. 2 of the participants engage in repetitive speech vocally, and 1 of the participants engages in repetitive speech using their assistive device in the form of a Proloquo system. The procedures for this current study include when repetitive speech occurs, we're going to immediately interrupt the repetitive speech by telling the participant to complete 10 compliance trials. We're going to use a mixture of vocal imitation and motor movements in the compliance trials. So, for example, do this while clapping your hands, do this while touching your nose, or say ah. Do not remove the assistive device if the participant is using one. But if the participant is not initiating to complete the task within 5 seconds, you may place your hand over the assistive device so that they are unable to press icons. If they don't initiate to complete the demand within 15 seconds, we can provide a physical prompt or a vocal prompt using least to most and using the least intrusive prompt necessary to get them to engage in the specified demand. We're going to do this until the participant completes 10 consecutive compliance trials without engaging in repetitive speech or attempting to engage in repetitive speech. For example, if after 6 compliance trials the participant engages in repetitive speech, we're going to start over and have them complete 10 consecutive compliance trials again. Do not provide any verbal reprimands. We're not going to say anything about having to start the procedures over or provide any additional attention. Once the participant has engaged in all 10 consecutive compliance trials, we're going to provide brief direct feedback, something like, "Great job doing what I did, bud," and we're going to continue doing what we were doing prior to the repetitive speech occurring. If the participant engages in repetitive speech again, we're going to continue with the RIRD procedures by following steps 1 through 4 that were highlighted earlier. If the participant engages in repetitive speech during a transition, we're going to immediately stop where we are and run the RIRD procedures that were listed. For 5 minutes out of each hour, we're going to allow the participant to engage in repetitive speech for 5 minutes in a room alone by themselves. We're going to crack the door and stand right outside the door so that we can see them for safety purposes and for data collection purposes. We're going to take data on the frequency of repetitive speech without intervention for those 5 minutes each hour. Given that studies have shown that RIRD is a successful tool in reducing repetitive speech and repetitive behaviors, and other studies have found that stimulus matching to the target behavior can be effective in the reduction of repetitive behaviors that are maintained by automatic reinforcement, it is hypothesized that through AB experimental design, it will be concluded that combining interventions, an RIRD procedure, and a stimulus matching procedure will significantly decrease repetitive speech in 3 participants with a diagnosis of autism spectrum disorder. Thank you.